I'd like to ask you about osteopenia. I think a lot of people, if I'm pronouncing it correctly, have that, which is a thinning of the bones. Does it usually lead to full-blown osteoporosis? Am I really in danger of getting osteoporosis?
Osteopenia is a generalized loss of bone. And osteoporosis has a lot of different causes. Osteoporosis also involves loss of bone, but frequently it's a metabolic problem. You can improve the strength of your bones and the quality of your bones with exercise. So we know that the stronger your muscles are, the stronger your bones will be and the more bone mass you'll have. So the best way to avoid osteopenia is to build up the strength of your bones, and exercise is the way to do that.
I'd like to know, what can we do to lower our risk of osteoarthritis and other bone joint diseases?
I think the best thing to do to lower anybody's risk is to basically stay in shape and stay as close to your ideal weight as possible, because the extra weight over time is what's going to lead to abnormal forces in the joint, which is going to lead to arthritis.
My question is about vitamin D, taking vitamin D. I already take medication for atrial fibrillation, and I'm not anxious to add more medications, even if it's just over the counter. So I'd like to know, how important is it to take it? Is it a chance that vitamin D pills will interact with other medications? What are the chances that I'll be okay without taking vitamin D?
Well, it is wise to consider not over pharmacizing or taking too many medicines. That being said, vitamin D is a very important part of our diet. Vitamin D is necessary for our gut to actually absorb calcium. It is also needed in helping our body process the calcium and metabolize it and incorporate it into the skeleton. Yes, too much of a good thing could be bad, and there can be interactions, but there aren't many negative interactions that are commonly known. It's always important to start a medication under the proper supervision of your primary doctor.
How advantageous is it to walk 1 hour every day to keep our joints in tune?
Walking is great for a lot of reasons. It helps to build the strength, it keeps you limber, so it helps with the range of motion of your joints. And apart from that, it helps to keep weight down, and it improves your cardiovascular health and your respiratory health as well. So I think it's very important.
As you get older, you should be doing two types of exercises. The first one is you need to be doing some type of weight-bearing exercise. So for most people, walking is just fine because your bones need some force against them to maintain their bone density. Walking also will help you burn calories and tone muscles, but it won't go as far as toning specific muscles. So for the lower extremities, especially for hips and knees, you should always do some exercises where you're toning the muscles around your hip and your knee in order to keep those joints strong, or keep the muscles around those joints strong. And I think that's probably the best way to minimize chances of arthritis.